Welcome back, my dear students. Today we are going to learn about diabetes mellitus or DM, a common but serious metabolic disorder where the blood sugar levels remain high for a long time. Why does this happen? Because of problems with insulin, the hormone that normally helps glucose enter our cells for energy. In some people, the body makes no insulin at all, what is type 1 diabetes. In other, the body cannot use insulin properly, that is type 2 diabetes. And in some women, it first appears during its pregnancy, which is called as gestational diabetes. If left uncontrolled, high sugar in blood slowly damages the eyes, kidneys, nerves, heart, blood vessels. But the good news is, with early diagnosis, healthy lifestyle, medicines, and regular monitoring, diabetes can be controlled and its complications can be prevented. In this class, we will explore what is diabetes, why it happens, the different types of diabetes, and how it can be managed. Let's break down step by step and make this important topic easy to understand. Diabetes mellitus. What is diabetes mellitus? It is not just one disease. It's a group of metabolic disorders where blood sugar or glucose remains too high for too long. Why it happens? Because of problems in insulin. Either the body doesn't make it or doesn't use it properly, or both. There are basically three types of diabetes. Type 1 diabetes, it is the autoimmune condition where the immune system attacks insulin producing cells, the beta cells of our pancreas. Type 2 diabetes, it is insufficient insulin secretion for blood glucose regulation. This is a problem in cell signaling. Here the insulin is produced in our body, but insulin is useless. Insulin cannot function properly. What is gestational diabetes? Diabetes that develops during pregnancy of the woman due to increased insulin resistance. Type 1 diabetes or type 1 diabetes mellitus or T1DM. Think of T1DM as the body attacking itself. Here our immune system destroys the beta cells in the pancreas, which cells normally produce insulin. So without insulin, glucose cannot enter cells and blood glucose level rises. What are the risk factors? Genetics, HLA-DR3, DR4, DQ genes, etc. Autoimmune destruction of beta cells, viral infection like Coxsackie, mumps, rubella, etc. Family history, environmental triggers like toxins, early cow's milk exposure. What happens, or what is the pathophysiology of type 1 diabetes mellitus? Beta cells are destroyed, so no insulin will be produced at all. Glucose stays in the blood, which causes hyperglycemia. Fat breakdown when increases, ketone bodies form, and it can cause diabetic ketoacidosis or DKA, a medical emergency. Management: insulin therapy, which is a lifelong process, injections, basal bolus or insulin pump. Diet balanced with carbohydrate counting. Exercise important, but insulin dose may need adjusting. Monitoring: blood sugar monitoring, hemoglobin A1C, ketone bodies, etc. Education: handling hypoglycemia, insulin use, lifestyle care, etc. This is the image showing type 1 diabetes mellitus pathophysiology. Normally, beta cells of the pancreas produce, store and release insulin, and it controls the blood sugar level. But in case of type 1 diabetes, our immune cell, the T cells, destroy pancreatic beta cells and resulting in little or to no insulin release, which is an autoimmune disorder. So our blood glucose level highs. So this is the basic cause of type 1 diabetes. What is the present treatment of type 1 diabetes? That is, the insulin is the only treatment of type 1 diabetes, but immunotherapy, gene therapy, cell encapsulation, stem cell therapy can be possible treatment of type 1 diabetes. Stem cell therapy is for type 1 diabetes involves isolation of stem cells, then reprogramming stem cells, differentiating stem cells into beta cell, and transplant the stem cells within the pancreas. Type 2 diabetes mellitus, this is the most common type of diabetes. 85% diabetes is type 2 diabetes mellitus. Here the body cells don't respond properly to insulin, and the disease or the abnormal situation is called as insulin resistance. At first, the pancreas makes more insulin to compensate, but over time the beta cells get tired and can't keep up. Result: persistent hyperglycemia. The risk factors include obesity, especially belly fat, sedentary lifestyle, that is lack of exercise, family history, age more than 40 years, but even younger people get it now, hypertension and dyslipidemia, which is a metabolic syndrome, history of gestational diabetes, poor diet like junk food, refined carbs, sugar drinks, etc. What happens, or what is the pathophysiology of type 2 diabetes? Insulin resistance in muscles, liver and fat. Initially pancreas makes extra insulin, later beta cells burn out, so less insulin will be produced, and chronic hyperglycemia damages blood vessels like microvascular complications like retinopathy, nephropathy and neuropathy, macrovascular complications like heart attack, stroke and atherosclerosis. Management: lifestyle modification, healthy eating, exercise, weight control, etc. This is the processes of management. Oral hygiene agents, OHA, metformin is the first choice, but sulfonylureas, DPP4 inhibitor, SGL2 inhibitors, GLP1 agonists, these are used as oral hypoglycemic agents. Insulin therapy if tablets don't work. Monitoring: HbA1c, blood glucose, blood pressure, lipid profile should be monitored to manage the type 2 diabetes. Prevention of complications: control BP and cholesterol, foot care, annual eye and kidney checkup, etc. So type 2 diabetes is a metabolic disorder in which there is insulin resistance and insulin function is impaired, insulin secretion is impaired, and it leading to high blood glucose levels. So these are the insulin receptors of the cell. Insulin resistance when insulin is there, but no, insulin is not functional. So type 2 diabetes body cannot use insulin properly. In adults, type 2 diabetes accounts for approximately 90 to 95% of all diagnosed causes of diabetes, and nearly 5,300 youth diagnosed each year in 2017 and 2018. Type 2 diabetes can develop at any age. Risk factors for type 2 diabetes being overweight, having a family history, being physically inactive, being 45 or older. Now, 1.2 million people 18 years or older diagnosed with type 2 diabetes in 2021. Gestational diabetes or GDM, gestational diabetes mellitus. This type appears only during pregnancy, usually during second or third trimester. Pregnancy hormones like human placental lactogen, progesterone, cortisol increases insulin resistance so that more glucose is available for the baby. But if the mother's pancreas cannot produce enough insulin, blood sugar rises and gestational diabetes mellitus develops. Risk factors: overweight or obesity before or during pregnancy, family history of diabetes, age should be more than 25 years, previous GDM or gestational diabetes mellitus, history of large baby more than 4 kg or stillbirth, polycystic ovary syndrome or PCOS. So what happens, or pathophysiology of gestational diabetes mellitus? Pregnancy hormones causes insulin resistance. If mother's pancreas cannot keep up, hyperglycemia occurs, blood sugar level will be increased, fetus gets high glucose, produces more insulin, and baby grows too large, which is called as macrosomia. Management: diet and exercise. First line treatment is the diet and exercise against the gestational diabetes. Insulin therapy if diet is not enough, sometimes metformin is used. Monitoring: frequent blood sugar check, fetal care, ultrasound scans for growth, amniotic fluid checks. After delivery, GDM usually goes away, but mother has a high risk of T2DM later in life, needs regular follow-up. In today's class, we understood that diabetes mellitus is a condition where blood sugar stays high because of problems with insulin. Either the body makes none, that is type 1, or doesn't use it properly, that is type 2, or it first appears in pregnancy when it is type gestational diabetes. High sugar over time can damage eyes, kidney, nerves and the heart, but the good news is with early diagnosis, regular monitoring, healthy lifestyle, lifestyle, medicine and insulin when needed, diabetes can be well controlled. Remember, check sugar, eat smart, stay active and care for your future health. Stay aware, stay strong and keep learning. See you in the next class. Thank you.